What made it work? What allowed you to trust us when you validly didn't trust most in the system?
The respect for my boundaries. And it's the consistency, the adaptability, the flexibility. Y'all are able to work with us. Y'all not working against us, y'all working with us. And that's what usually happens in the system. We're used to people working against us, trying to find us services. This doesn't feel like a service, it feels like actual help.
Kaleidoscope is unique in a way that they are not just postured as this sort of social service agency, right? The social welfare agency. They put a social justice spin on what they do, right? This deep belief that we can elevate the voices of families.
If you got a family backing you up, behind you, that's good. But Kaleidoscope, they're going to be there. They've been there.
But I want to make sure that we're doing more to make kids and families whole early on. And we're not a reactionary agency, that we're a preventive, intentional agency to keep kids and families together.
We have a lot of services and programs, but we don't think of all these services and programs as an integrated way of working with families. We have to start a ground game.
We can create this network and this community that hopefully will meet whatever need comes our way.
Kaleidoscope is constantly making partnerships and collaborations with other agencies that will be a support for the families that we service.
We all have our own little network of agencies that we work with. Like, I know who I'm going to call for housing. I know who I'm going to call for childcare. And if you work for an After School Matters program, you have a whole set of different programs that you're accessing. So we are so much stronger when we're working collaboratively. Coming from a small town, my community responded when there was a need, right? Child welfare has been built on agency capacity, not community capacity. So the hub concept would be that everything would be under one roof.
That we can be available to families when they want us and before they need us is a really exciting possibility.
And I think that's the future of Kaleidoscope. Putting families in that driver's seat, saying that we see you, we hear you, your needs are front and center, and your strengths are front and center.
For the clinical department, we're looking at making a shift to more community-based mental health services rather than just being able to see the clients who come in through our DCFS programs.
It's about human connection. We've always been about connection. That's the thread that keeps us all going every day, is our connection to each other. And so it's so important that we think about being connected in our communities again, especially for our families that we serve.
Congratulations, Kaleidoscope, on the past 50 years of fostering life-changing connections with children, youth, and families.